everyone. Welcome to another injury recovery interview. And today's interview is slightly different because I'm going to be talking with another injury recovery coach. And there is not many of us out there. So I'm extremely happy to be talking today with Heidi Armstrong. And, Heidi was an elite athlete. And in her own words, she went from that to being a cripple. So today we're going to be talking about her recovery journey, what was happening with her, how she became a coach. And we're going to be also talking about you injured souls who are watching this. So Heidi, thank you so much for joining me.
Thank you, Maya.
Oh, absolutely. So, like I mentioned, you were an elite athlete. So you were a mountain bike racer. And in the summer of 1999, you had your first accident, if I'm correct.
That's
so,
exactly right.
Yeah, what did happen?
So I was at a race in Pennsylvania, and it was at a ski resort, and I was riding my mountain bike, actually pre-riding the course so I could determine what sections of the course were scary. And there was a really gradual, nice, easy downhill. And there are indicators on mountain bike race courses for steep downhills. So there's a 1 arrow down that's heads up, this is steep. 2 arrows down is this is steep and probably pretty technical, and 3 arrows down is you may want to consider getting off your bike and walking. So I saw 3 arrows down plus a skull and crossbones, and I thought, but it was a really easy section of trail, and then I slowed down some, but not enough. And I thought I could probably ride this. And all of a sudden the trail turned to the left and literally fell off the face of the earth. And it was really rocky and extremely steep. And it was a bunch of loose silt. So like the dirt that's left behind on a ski mountain after the snow melts. And I was at the top of this hill, and I thought, well, I could either bail now and crash and probably roll down the whole hill, and that's going to really hurt. Or I can try to ride it out and see what happens. And so I tried to ride it out, and it was so steep, I was basically sitting on my back tire. And I had all this momentum going down the hill, and I made it all the way down. But then at the bottom, there was this pit of sand, basically, or silt. And so I had all this momentum and hit that pit and just stopped. And so my bike went one way, and I kind of twisted the other way, and I came out of one pedal, but not the other. And so there was a twist in my knee. And it was very painful at first. So I just sat on the side of the trail and waited for a bit. So what ended up happening is some cartilage on the back of my kneecap, a significant amount of it broke off. So I had what we call osteochondral damage.
Wow.
Diagnosed for about a year.
So that actually happened, a day before the actual race?
Yes.
So did you know right away that something was not completely okay, or did it take you a while to figure that out?
The pain was bad, so I knew something wasn't okay, but I stayed off of it that day, and then I had flown from Texas to Pennsylvania, so I thought I'll just do this race. So I did it the next day, and it was more or less okay. I still knew something was wrong, but I was able to race, and I just thought I'll kick the can down the road and deal with this when I get home. And so that's what I did.
Yeah, it's like, I don't have the time for this. First is race, and then let's deal with everything else.
Yes.
So when did you figure out that something is off, or what happened after that? So did you go to the doctor once you came back home?
So I went back to Austin, which is where I live, and I went to see an orthopedic doctor, and he said, well, you probably have maybe some cartilage damage, and I think you should just rest for a while. He did some x-rays, and he said, I think you should just rest for a while, and then when you feel better, slowly get back into cycling. And so I did that cycle over and over again for about 8 months. And then I decided I didn't like that doctor very much, so I went to see somebody else who did an MRI and then found the cartilage defects in that MRI.
Well, this is so important, because sometimes I know that injured people are sort of afraid to ask for a second opinion, or maybe it's like, well, he or she is a doctor, so I'm just gonna do what they say that I supposed to be doing. And sometimes they just don't want to ask for a second or third or fourth opinion. But it's so important that you listen to yourself, and if something feels off, you go and ask someone else.
Yes, and I don't want to completely sidetrack our conversation, but you bring up such a good point, because so many people just say, okay, I saw a doctor and I've checked the box, but we all have feelings when we go in to see a doctor. Like, we notice, am I being dismissed? Is he looking at me? Is he actually listening to me? Is she looking at a computer instead of paying attention to me? Is she thinking about the next appointment she has? Is she really stressed out? So we get a vibe from that doctor when we come in to the room. And I think it's so important to pay attention to that, because in your team that you have to help you, you need someone that's going to listen to you and believe you and support you and be present with you.
Yes, absolutely. And this is so important, what you just said, that you need to have a team. It's not just, maybe one person like a surgeon and then maybe a PT, but you really, I love that saying, it takes a village to raise a child, so yes, you need a team to make this recovery really awesome and like you wanted to have it. So absolutely. And, with the emotions and everything, so you were an elite athlete. So, and then all of a sudden things changed. So how was that for you mentally and emotionally? I know that physically was hard, but that mental and emotional part of recovery sometimes can be even harder.
Yes, it was much harder for me. And in that year where I kept trying to go back to cycling and back to racing, and then I would hurt, and then I would rest, and then I would go back. So when I was in that cycle for a year, I was not doing great mentally and emotionally, but I still, my bike was within reach. It wasn't off limits yet. And so I would say that at that point, I wasn't suffering too badly mentally. But when I finally realized the extent of the damage and that I was going to have surgery, and maybe more than one surgery, and it was going to be a really, really long recovery with a lot of tedious exercises, tedious and boring exercises, that's when I completely came unglued, because I realized that now my bike is out of reach, and this thing that I used to cope with stress from the past and current stress was gone. And it was my only coping mechanism. And it was basically my identity. Like it is for, a lot of people, their sport is their identity, and it's how they cope with stress. And so I'm normally an even-tempered person and pretty easygoing. And I got angry. I had a short temper. I was living with my best friend, Christine, at the time, and she's like a sister to me. And she had to have an intervention one day because I was making really, really bad choices about things that felt like I needed to do to cope with my injury. Like, for example, I would clean a lot, and I wasn't supposed to be up standing. I was supposed to be lying down with my leg above my heart after surgery, and I would be up just cleaning the apartment like a tornado. And because I couldn't go out and ride, and I felt like I had to channel my energy somewhere, and that's what I did. But it was a very unhealthy decision. So she came home from work one day and saw me on the floor cleaning what was at the time a cassette tape collection with paper towels and Windex. And she came in and she said, "What are you doing?" And I got really angry. And so she ended up having an intervention with me, which brings up another point. When you're injured, I say when you're in the bottle, you can't read the label on the outside. And I was very much in a bottle. And I didn't realize how bad I was doing mentally until she pointed it out to me. And I think it's really important when you're injured or going through any life challenge that you have people, at least one person in your life that I say will tell you the truth and that you will believe them. And so you have to maintain yourself and not get defensive and act on the feedback they're giving. And that's what I did. So the first thing I thought was, well, that was really hard to hear after she mentioned you can't cope with your injury this way anymore. You've got to do something different. And then the next thing I thought was, well, that was really brave of her. That took a lot of guts to say that. And then the third thing I thought was, she really loves me. And she cares about me, and she sees that I'm suffering in a way that I don't have to. And so I need to act on this. And so that's what happened with me.
Yeah. Oh, absolutely.
Not pretty.
Yeah, no. And I don't know if you were on any type of pain medication as well. No, because I know how hard it was for me, being on opioids and those strong painkillers, and it was just driving me nuts. And the hardest thing for me was that, if you're around a person who is being really cranky, you can move yourself away. But if you are cranky and you know that you cannot escape yourself. Yes. And that was one of the hardest things for me. It's like I cannot escape this, everything that was happening in my head.
Yes, and you on some level that when you want to escape your own self, there's probably something going on that's not good, but I just did not have the awareness that
yes.
it had gotten so bad.
Yes, yes.
And I had become so depressed and so angry and so intolerant. I just didn't realize it. I didn't see it myself.
Yeah. It's important to have someone who has guts to tell you things like that. And, sometimes we really need that extra push that we really then do a step towards the solution, not just being in that, dark place or whatever and being, we really like punk. We need that.
Absolutely.
Yeah. So your recovery journey actually didn't stop there. So you had another fracture in 2010, and you fractured your knee. And what happened is that this led to a condition called arthrofibrosis. So can you explain, I know that you have a whole page on your website about this condition, but can you explain what this is?
Yes, sure. So arthrofibrosis is a scarring condition. It's a chronic scarring condition. And so arthro means joint and fibrosis means scarring. And so most commonly it happens in knees and elbows in the body. And it can happen in knees. I'll just talk about knees since that's what happened to me, for one of four common reasons. So it can happen after a knee replacement. It can happen after a knee fracture. It can happen after a routine surgery where somebody gets an infection. Or it can happen after someone has torn their ACL and they have surgery without getting their full range of motion back before they have surgery. And if we're to really oversimplify it, anything that causes bleeding inside the knee joint can also cause arthrofibrosis. So is it likely that you're going to get it if you fall down and hit your knee really hard and you have a bone bruise? Probably not, but it could happen. It's a very rare condition, and it's really difficult to diagnose and even more difficult to find somebody to treat it. But that's what it is. And so in the knee, the way that it first appears with people is that they will have an incident, an injury, surgery, fracture, whatever, and then they have a lot of trouble regaining their range of motion.
Okay. So were you diagnosed with this right away after the fracture, or how did you actually realize that you have arthrofibrosis?
So what happened to me is the part of my knee that fractured is where your ACL attaches to your shin bone or your tibia. So that part of my tibia broke off into multiple pieces. And so I waited. You're supposed to wait about a month or maybe more to regain your range of motion before having surgery after an ACL tear. And my injury, because my ACL had detached, the doctor was going to do an ACL reconstruction. And so during that time when I was waiting, I was in a brace because I had also torn my MCL, which healed on its own. And I could never get my leg fully extended because part of the fracture prevented me from doing so. It was actually sticking up into the joint. And so I had gained most of my flexion back and I did not have full extension, but we went on with surgery knowing that it was a piece of bone that was preventing that. So when the doctor went in to do what he thought was going to be an ACL reconstruction, he found all the scarring in my knee. And so I remember waking up from surgery, I was touching my leg trying to figure out what he had done. And the nurse said to me, he didn't have to do the ACL reconstruction. And I was really confused. And finally he came in and talked to me and he said, well, I went in and he said, your ACL is maybe about 80% gone, but he said the bone actually 20% gone, but he said the bone is reattached to about 80% of it. And so I don't need to do the reconstruction, but the bigger issue is the entire front of your knee was completely scarred down. And so he said, I cleaned that out. And the words clean that out, those are very significant. So he did that. And I felt pretty good. I still couldn't bear weight on my leg because it was still fractured. And then I started to come off crutches very gradually. And he just told me do things gradually, learn how to walk again gradually. I was also in physical therapy. And the whole front part of my knee started to feel really stiff and inflexible and like concrete, and I could not straighten my leg out. And so I went back to see him after about 2.5 months, and what he told me was that the scar had come back. And so he wanted to go in and clean it out again, and I didn't know any better. So I went in, he did that surgery again, and by this time I was off of crutches. I used them again after surgery, but when I came off of them, for about 6 or 8 weeks, that's also significant, I felt pretty good. And then I slowly started to do things again, and the scar came back again. And so I went back to see him again about 5 months later, and he wanted to clean it out again. And that's when I thought, no, there's something else going on here. And my friend who's a physical therapist, Doug Kelsey, he said to me, I think you should go see this Dr. Richard Stedman in Vail, Colorado. And I had heard about him in college doing research for a paper that I wrote. And he's a very famous orthopedic surgeon and pioneered a lot of arthroscopy techniques. And so that was the second time I'd heard his name. And then I also had this idea in my head. I had a really, really bad limp because I couldn't straighten my leg out. So effectively, my legs were different lengths. And my best friend, Christine, is also a physical therapist. And I remembered from my first injury that she had a patient that fractured his knee. And I remembered that it was really stiff and he had a lot of trouble walking. And so I asked her, do you think I might have what your patient had? And she said, yeah, it's a possibility. So about 10 months after I had surgery in Austin, about 10 months, and it was also 11 months after the injury, I went to Vail, Colorado and saw Dr. Stedman, who's an expert in arthrofibrosis, and he finally diagnosed it. And one of his main criteria for diagnosing it is immobility of the kneecap. So when you go to move the kneecap around, it doesn't move. It's like concrete.
So, not every knee fracture ends in arthrofibrosis.
Yes.
So do you know why this happens to some people but not all people?
That's a good question. So some of it is random. And then some of it is, does your team of physicians, surgeons, and physical therapists, do they know a lot about arthrofibrosis? So what happens when you have bleeding inside the knee joint is that the blood it pools there. And so that blood can do one of two things. It can either be reabsorbed by your body and you just get rid of it over time, or it can turn to a gigantic scar network. So I met somebody else who had a knee fracture similar to mine, and she actually did it in Colorado and had a surgeon from the Stedman Clinic do her surgery, and then she started her rehabilitation there. And they know about arthrofibrosis, and they know that you're at very high risk for getting it after a fracture. And so they taught her exactly what to do to prevent it in rehab. And so that's why her outcome was very different than mine. My doctor, even though he is a good surgeon, he hadn't seen it before. Mm-hmm. And it's not something that surgeons see in their residency because it's a more of a long-term complication of an injury instead of an acute trauma. And so he didn't understand it, didn't really understand the physiology of scar, and then made the wrong rehabilitation recommendations to me.
Yeah, so absolutely, physically, if you know what to do to prevent something, and back then, if you would know what to do, then maybe you wouldn't be in this situation. Do you think that that's correct?
Yes, I think that if I'd had a surgeon who understood from the very beginning that that's what I had going on, had used a different tool in my knee and had not cleaned it out, because you're never supposed to do that with a scar. Because when you clean out a scar, you disrupt it and you cause all this bleeding in the knee, and you cause the same environment that caused the scar to begin with. So you never want to do that. And so if he had not used it, we call it the shaver. If he had not used a shaver, and if he had given me different rehabilitation recommendations, I may have had a different outcome. I may not have, but it would have put the odds in my favor.
But maybe if that would happen, then maybe right now you wouldn't be such an amazing coach, because you wouldn't have so many experiences and everything. And I would, love to ask you this. So, now you are helping injured people and especially injured athletes. So how did you start with coaching? When did you realize that this is something that you want to do?
I started doing this informally back when I had my first injury. So when my friend said to me, you have to get help, the first person I reached out to was a psychotherapist, because I just didn't know who else to speak with. So I found a good psychotherapist and a different surgeon and a different physical therapist and a few other people to put on my team or in my village, because we talked about that before. It very much takes a village. And those people saw that I was an emotional wreck when I came to them. And after about 6 or 7 months of intentional, I call it mental training every single day. So I did things like I learned photography, but like the physics of light and lenses, and I learned it that way. And I picked up multiple other creative outlets and journaling and things like that. And many of these things were things that my care team recommended that I do. And I was in such a bad place. I just thought, whatever you say, I will do. I will do it wholeheartedly. And so I was able to, with work, turn my attitude around. And so the people that helped me began calling me and saying, I have a client or I have a patient and they're an injured athlete and I don't feel like they need psychotherapy at this time, but they need to talk to somebody else that's been in the hole and knows the way out. And so I worked with injured athletes informally. I had another couple of careers during that time, but it was maybe a decade or a little bit more before the knee fracture happened. And then my impetus for starting to do this as my career was that my previous career was in the medical device industry, which involves standing all day long in operative cases. And I won't ever be able to do that again, which isn't to say that I can't be functional, because I am very functional, but I can't stand for that long. So I had to find something else to do. So I was thinking about what is it that I want to do. And I was at the time working with a couple of injured athletes. And then I think the thing that really tipped me over the edge was I was on an exercise bike at physical therapy, and there was an active NFL football player, so like American football, on one side of me, and then a guy that was about 65, and he learned how to ski before he even remembers. And we were all talking about what we were going through with our injuries and rehabilitation. And we all had very different injuries as well. But I realized that we were all using the same words to describe what we were going through. And I thought, oh, there's this connection. And we're really different, but we're all connected in this way. And so that's when I thought I would like to do some research about this. And then I think I would like to do this as a career. But I want to start with research first. And so that's how it all came together for me.
Yeah, I love what you just said, because I spoke with hundreds of injured people during these years as well. And I also noticed that some words and how people describe their suffering and injuries, some words just pop up constantly. And, you did that research with probably mostly injured athletes. So what did you actually figure out? What kind of words are people using to describe their suffering?
The first thing that I'd like to say is that I very quickly had to redefine the word athlete, because a lot of people will say to me, oh, well, I'm not an athlete. Well, I had to redefine the word. And to me, an athlete is anybody who uses movement to connect with their life. And so in my research, I included people as young as 14 and as old as 74. And I picked every sport you can think of and different levels within the sports. And I divided it equally in male and female. And I intentionally wanted a really, really diverse group of people. And what I found is that the most common words they used to describe what they were going through were frustration, impatience. Men tended to say angry and women tended to say sad, but that's not a hard and fast rule. It's just a trend. And then what I call disconnection. And so both disconnection from their own body, as in my body let me down and I'm angry at my body, and then disconnection from the people that I used to enjoy doing my activity with. And so that could be your friends, your teammates, your people you used to meet every morning to walk with. And what I discovered is that the guy who's 70 and walks his dog every morning religiously with a friend suffers in the same way that a professional athlete does. And of course, there are some differences there. Like one person, their livelihood depends on their sport. So, but at the end of the day, the fundamental suffering is identical.
And I can add to this bunch, which is absolutely what, when I'm talking to people is exactly the same. And sometimes, a lot of the times I also hear I'm anxious and depressed. Yes. And, just being there and sometimes being like trapped, feeling like being trapped and, just don't know how to move forward. So yeah, definitely. And do you, sometimes we get really caught up in our stories. So do you think that the way people describe their suffering, that this can affect their recovery as well?
Yes, I think words are so important, and the words that we choose are so important because your brain hears them and then you internalize them and then you become that. And it's this whole thing about what we focus on grows. And so I think the words that we choose are so, so important.
Absolutely. And if it would be possible, going back to 1999 with your knowledge, or maybe, just as you are going back, what would you say? What kind of advice would you give yourself, like so many years ago? What do you think that it would be the most beneficial advice that you could give yourself?
I think the first thing I would say is that you are a whole beautiful human being. You have so many different facets and dimensions to who you are. You are not just an athlete, and your worth doesn't depend on how well you did in your last race or how good your last workout was. And that instead of focusing inward on you as an athlete, begin to focus out to the world. So connect with nature, volunteer, just get out of your own head and your own stuff.
Yes, absolutely. Because when you are caught in that box and just, thinking over and over and over again about the same things, it's not like a pleasant place to be. Plus, it doesn't help you, because if you are just in that negativity and negative thoughts and everything, it cannot basically help you in your recovery.
Yes. This is I call it the spiral of disconnection. So the more we think about ourselves and our pain and our injury and how bad things are, and the more we use negative words, the more we spiral down this tunnel of disconnection. And the disconnection leads to depression, and it leads to anxiety. And so I think that happens when we go inside, when we just think about, it's only me, I hurt, all of these things that are reflective of ourselves. But if we can get out of that thought pattern and, like I said, connect with the world, with our friends, it's the exact opposite thing our mind wants to do in the situation. We don't want to ask for help. We don't want to leave the house. We just want to sit there and be miserable. But at the end of the day, we have to overcome the discomfort of changing and doing something different if we want to feel better.
Absolutely. Absolutely. Heidi, that was amazing. And can you please tell us where people can find more about you, about your work, for those who really resonate with your words and, your energy and everything?
Oh, thank you, Maya. So my email address is Heidi, it's HEIDI, at injuredathletestoolbox.com, and that's athletes with an S on it. And then my website is injuredathletestoolbox.com.
Awesome. Heidi, that was amazing. I'm so grateful. When I found you online, I was like, oh my gosh, I'm so excited, because there is another injury recovery coach. And like I said at the beginning, there's not a lot of us out there, and people really need this type of help. So I'm extremely grateful for your work, for what you do, helping injured people in these difficult situations. And, your experience made you the coach that you are today, and experience is really, important in this journey. So thank you so much for joining me today. And yes.
I'm so excited to find you and meet you too.